Balloon 9-to-1 Aeromedical Factors. Greetings, aviators and enthusiasts, as we embark on a journey through the intricacies of aeromedical factors, an essential chapter in the aviation tapestry. Join me as we unravel the threads of knowledge concerning medical certification and the physiological nuances entwined with our celestial pursuits. In the vast expanse of aeronautical regulations, most pilots find themselves tethered to the imperative of possessing a valid medical certificate to wield the privileges of their airman certificates. However, behold, my fellow balloonists, for in our majestic spheres, balloon pilots are bestowed the exemption from this medical certification mandate. Yet heed this caveat, for ventures beyond the borders of the United States may cast a different hue upon this exemption. Balloon pilots partaking in aerial escapades in the realms of Canada, for instance, might find themselves obligated to secure a second-class medical certificate to ferry passengers through the skies. A prudent sage, therefore, consults the scrolls of Title 14 of the Code of Federal Regulations, 14 CFR, Part 61, where the tenets of medical certification are etched. Seek guidance from the keepers of wisdom, the aviation medical examiners, AMEs, accessible through the annals of local directories or the hallowed halls of flight service district offices, FSDOs. As we venture further, let us unfurl the parchment that reveals the intricate dance between environmental and health factors that pirouette alongside pilot performance. Behold, a myriad of physiological intricacies linked to flight, from the subtle tremors of hypoxia to the tempestuous currents of stress and fatigue. Our mortal vessels navigate a delicate ballet in the celestial theater. Hypoxia, the silent waltz with reduced oxygen, envelops our consciousness. The four forms of this aerial specter, hypoxic, hypemic, stagnant, and histotoxic, weave a tale of oxygen's elusive dance. From the rarefied altitudes to the realms of carbon monoxide whispers, the pilot must be attuned to the subtle cues of the physiological orchestra. The ghostly whispers of hypoxia unveil themselves through the ethereal symptoms that dance on the stage of pilot consciousness. Cyanotic fingers and lips, the subtle throb of a headache, the somber cadence of impaired judgment, a symphony of warnings. As we ascend, the celestial curtain descends, narrowing the field of vision, compelling us to heed the call of supplemental oxygen. For in the rarefied heights, the time of useful consciousness dwindles, and the pilot must personalize their altitude limit, a sacred decree in the hymn of aviation safety. And now, a choreography intertwined with hypoxia, the beguiling dance of hyperventilation. Emotional stress, fright, or pain beckon the breath to quicken its pace, a masquerade of urgency. Symptoms akin to hypoxia play a tantalizing game, and the discerning pilot must unravel this enigma. A pale, clammy visage and spasms distinguish hyperventilation's ballet, and the antidote lies in the rhythmic embrace of normal breathing, a return to equilibrium. Let's dive into how our ears and sinuses handle pressure changes when we go up or down in an airplane. Inside our heads, there's a middle ear with an eardrum, and it needs to balance the air pressure with the outside world. This is where a small tube called the eustachian tube comes into play. It opens when we chew or swallow to make sure the pressure inside and outside our ears stays in harmony. But sometimes, even a small difference in pressure can make our ears feel weird. Our sinuses, which are connected to our noses, also have a say in this pressure game. If we have a cold or allergies, things can get blocked, especially during the descent of the flight. This block can cause pain over our sinuses and even in our upper teeth. We might need to adjust how fast we're going down, or in serious cases, see a doctor. As we go up, our middle ear has its own dance with pressure. The air pressure inside it might become higher than in the ear canal, making the eardrum bulge out a bit. Pilots feel this as a full and clearing sensation. On the way down, it's the opposite. The ear canal has higher pressure, pushing the eardrum in. To help with this, there's a trick called the Valsalva procedure. Pinch your nostrils, close your mouth, and blow gently into your nose. This pushes air through the eustachian tube into the middle ear, relieving any potential pain and bringing back normal hearing. But be careful. This trick might not work if you have a cold, ear infection, or sore throat. Flying in these conditions can be painful, so it's better to avoid it. For a bit of congestion, nose drops or sprays might help ease the pressure and make the flight more comfortable. In the air pressure balancing act, understanding how our ears and sinuses work lets pilots navigate the skies comfortably. The eustachian tube takes center stage in this high-flying performance. Balloon pilots usually don't face problems with spatial disorientation during regular flights, as they typically operate under visual flight rules, VFR. However, understanding these concepts is crucial in case of unexpected situations like flying into fog or areas with low visibility. While balloon pilots rely heavily on visual cues in good weather, they should be aware of potential issues in challenging conditions. Spatial disorientation refers to the confusion about the aircraft's position, attitude, or movement in space. The body uses the eyes, kinesthetic senses, and the vestibular system in the inner ears to understand orientation and movement. These systems usually work together to provide a clear picture, but conflicting information during flight can lead to disorientation. In visual conditions, the eyes dominate, but in instrument conditions without visual cues, false sensations may cause disorientation. The vestibular system, located in the inner ear, plays a crucial role in sensing movement and determining orientation. 3 semicircular canals in each ear, filled with fluid and fine hairs, send signals to the brain about acceleration and motion. However, these signals can be misleading, leading to spatial illusions and false perceptions of the aircraft's orientation. While balloon pilots and passengers typically don't experience spatial disorientation during routine flights, understanding these concepts is essential for safety. Additionally, motion sickness caused by conflicting messages to the brain about the body's state can occur during initial flights, especially due to anxiety and stress. Fortunately, motion sickness is generally not a significant concern under normal balloon flight conditions. Stress is the body's response to physical and psychological demands, involving the release of hormones like adrenaline and increased metabolism. Stressors, such as noise or difficult situations, can lead to acute, short-term, or chronic, long-term stress. Acute stress triggers a fight-or-flight response, while chronic stress becomes an intolerable burden that can impair performance. Chronic stress from financial worries or work problems can significantly affect an individual's ability to cope. Fatigue, often associated with pilot error, can result from sleep loss, exercise, or mental strain. It also has acute and chronic forms. Acute fatigue is short-term and is normal after strenuous efforts or lack of sleep. Skill fatigue, a special type of acute fatigue, can affect a pilot's performance, causing timing disruption and perceptual field disruption. Acute fatigue can result from factors like mild hypoxia, physical and psychological stress, and depletion of physical energy due to stress. Preventing acute fatigue involves proper diet, rest, and sleep. Adequate rest helps maintain vital energy stores. Chronic fatigue, lasting a long time, often has psychological roots and may require medical treatment. Continuous high stress levels can contribute to chronic fatigue, leading to symptoms such as weakness, tiredness, headaches, and emotional issues. Pilots experiencing fatigue should prioritize rest and nutrition, avoid flying without adequate sleep, and consult a physician if chronic fatigue is suspected.